OhioHealth was facing a new challenge as our program grows, and at Riverside in particular we hit capacity and we had to make some decisions on how do we treat our patients most effectively. So we explored growing Riverside, but realized it's probably not the most convenient things for patients to come inside the Beltway. So we explored different regions around the city where our patients come from, and we identified Dublin as one of the key locations where a lot of patients transfer from to us. That being said, the one thing we did not want to do is compromise patient care. We wanted better patients' convenience without a sacrifice of patient care. We explored Dublin Methodist Hospital as a key location, but we built it such that there is no compromise in the clinical care to these patients. We always wanted to have the same high-tech solution for our patients in the high level of care they would receive at Riverside, but in a more convenient location. That being said, at Dublin, it's the same exact equipment we have at Riverside, but more importantly, it's the same clinical staff. The radiation oncologist at Riverside will be treating the patients up at Dublin. Radiation oncology at OhioHealth is the epitome of systemness. Everything we've done to grow our program of radiation oncology at OhioHealth is about systemness. It's a unified medical record. It's the same high level of technical equipment at each facility. It's unification of everything we do across our system. Some examples of high technology across the system of OhioHealth is a single unified electronic medical record that can be accessed from any of our care sites by any of our care providers. Another example would be a unified treatment planning system to increase efficiency and collaboration amongst the clinicians to review cases together and to comment and make changes. In addition to that, high efficiency means load balancing of the workload. So staff at different facilities can actually pick up the workload of another facility to get the plans done quicker so we can get patients on treatments faster. Some things patients might not recognize as being helpful for OhioHealth Radiation Oncology is everything we do in radiation oncology at OhioHealth is patient-focused. The reason we built the Dublin facility was for patient care and patients' convenience to receive their treatments. Cancer patients typically will be coming to a facility daily for up to 8 weeks, and every minute we shave off a day and more convenient we make those treatments for a patient every day. It lends to their experience with that. That being said, the one thing we don't want to do is compromise their clinical care, so we have to put the same high-end technology at all our facilities so they can have access to the same level of care regardless of where they live, and recognize that we're doing this for their convenience. I think the most important thing in our focus is delivering the best clinical care to our patients. But in addition to that, we take it one step further in making their care as convenient as possible. And we put the burden upon ourselves to do the extra stuff to make the patient experience better. So if that means a unified medical record, if that means having high-end technology closer to the patient's home, if that means us doing centralized scheduling, hopefully most of this stuff is going to be transparent to the patient, but recognize behind the scene there's a huge staff of associates that are doing everything humanly possible to make this experience the best thing for these patients without compromising the high technical care that the patients deserve.